So this is our actually infusion center. It's outdoor. I never seen any infusion have outdoor infusion center, which is pretty nice because some of these patients will come and they will spend 6 to 8 hours in infusion center. So it's pretty nice to spend in the nature outdoor, and they get their chemotherapy or transfusions. So I really like this place. So I was surrounded by physicians, my brothers, cousin, uncles. Everybody around was physician when I was growing up. I used to go to their offices and hospitals to round with them and see how they were helping people, how compassionate they were. Then I went to school and college. I really like science, especially biology. I think family influence was the major factor for me, how they were helping people. Really inspired me to decide to go to medicine. My wife is a physician, so when I go home, we on dining table we discuss medicine pretty much all the time, and I work from home as well, checking on the patient, labs, scans, and different stuff. And of course, I have to read too, just to keep myself updated. The new guidelines coming out on oncology. Every day there is something new coming in oncology. To keep myself updated with that, I go and read every day. So what I do in oncology, the cancer, the diagnosis and the treatment, of course the chemotherapy agents, their mechanism is a lot of people, they don't understand. So what I do is I write them down, make a cartoon and diagrams for them just to simplify. So they can remember and make it really funny way so people enjoy it and they remember really simple way. I think that's the key. A lot of people, they don't have understand their diagnosis. They don't know their stage, what kind of cancer they have. I try to explain to them. I go through the guidelines and show them the data. Some of the patients want to know everything, and of course I have to put everything what the data is. If they are interested in the prognosis, I explain to them this is the prognosis with the treatment, this is without treatment. Some of the patients, they don't want to discuss. They want to take day by day at a time, and they don't want to hear the prognosis. All the patients are different, and their mentality and their approach are different. I was always interested in community oncology. UHC, of course, is a great place. They have everything, all the modern technology. They have PET scan, MRIs, and all the supportive staff as well. They have great oncologists already here. Great to be working with them, Dr. Osman, Dr. Brager, and we have one of the best radiation oncologists here, Dr. Stewart, here as well. See, I was kind of surprised when I came here. We see a lot of patients. It's extremely busy. We see all the pathology that the bigger centers can see, and we have the equipment to treat them and the support staff. We have navigator, which I never heard in any other cancer center. Navigator is so helpful for the patient and the physician as well. Any question the patient has, they call the navigator and they guide through the whole process. So when the patient is diagnosed, they are not there by themselves. We walk them through the treatment through navigator is the physician, the nursing staff. So it's a teamwork here. The whole environment in the cancer center is really friendly. We support each other. We have a great tumor board. We have tumor board every Thursday. We sit down with the radiation oncologists, pathologists, surgeons. Everybody sit together and make plans for all the patients who are complicated, or if we have any question, we bring that to tumor board and discuss that there. A lot of people will be diagnosed with cancer. They want to go to bigger center to get their opinion and treatment. Of course, the treatment guidelines is same all over the country. In fact, internationally, they will follow the same guidelines. And I will see a lot of patients. They will go to bigger center or come back. They're going to give me the same chemotherapy. So I think we have all the resources here at United Hospital that any center in the country can have. If you talk to the other specialty doctors, they will say oncologists are the more optimistic and hopeful people, and we have to be, because some of these chemotherapy drugs will response rate of 20-30%, but we are still hopeful that our patient will be included in one of them. So hope and optimism is the key for being an oncologist. It's the most satisfying thing for me is when my patient is cured and I tell them that you're in remission. That's the amazing and the happy part for us being oncologists.